this week's edition of the 3 healthcare headlines you need to know from Tallahassee. My name is Fraser, Cobbe. I'm pleased to be with you here again this week and want to give an opportunity for my partner in crime here, Joe, to introduce himself as well.
How's it going, Fraser? Yep, I'm Joe Daraskevich, and I'm lucky enough to work with several societies across the state. And each week we get the chance to recap what's going on over in Tallahassee. And Fraser, this week we have a special guest. You want to introduce her a little bit?
I do, yeah, definitely. You're probably wondering why my background is different. It is Groundhog Day, so I assume this is like the first visual Punxsutawney Phil has as he comes out of the ground. But because it's Groundhog Day, I didn't want it to go another week where it's just me and you, Joe, talking on this thing. So I did bring in a pinch hitter here for us. Toni Large is with us. Toni is a lobbyist in Tallahassee, has worked with several of our associations for a number of years. She's with Large Strategies and wanted to give an opportunity for Toni to say hello.
Nice to be here today on Groundhog's Day.
Terrific. Thanks so much for joining us, Toni. Hey, Joe, let's dive right into the headlines for this week.
Right, like we do each week, we've got 3 headlines. Let's kick it off with, will we be saying goodbye to non-compete clauses in physician contracts? Fraser, you want to take that?
Yeah, it's a bill that's been filed a couple years in a row over on the Senate side, and this year there's versions that have been filed in both chambers. The genesis of this, of course, is as healthcare systems and hospitals and corporate entities continue to grow and take up more of the capacity for care delivery in the state. There's some concern that physicians, when they have non-compete clauses, are faced the prospect of either sticking in an uncomfortable employment situation or having to uproot the family and move very far away from where they're currently practicing. So that's kind of the genesis of the bill. And Toni, why don't you tell us a little bit about kind of its progress this year and where we are with the bills moving forward?
Well, we have seen the bill move this week in the Senate. Senator Broder is the sponsor. It did have an amendment that made it a little closer to what we've seen in the House version. It would still keep the non-compete there. It put in some language that said it was only enforceable if the physician was making 250 or less per year. So any doctor making over that, it wasn't enforceable, this non-compete. I think what we know, though, is to remember this is a piece of legislation on non-compete. Even if it passed, it would still allow any physician to also use some other tactics that are out there, which is non-solicitation. So if you're bringing a new partner in, you could say, if you leave the practice under this new legislation that passes, if it does pass, you still can't solicit my patients to come to your new practice. So, those 2 things in tandem, I think most physicians are happy with, that it gives them the protection they need, but at the same time has some caveats. We haven't seen the House bill move as of yet. And it's got 3 committee stops, but the Senate bill is definitely moving.
Okay, so movement in the Senate, but still some stops to go. Okay, we'll keep an eye on that, Fraser, as we move along in this legislative session. Moving on to the second topic this week, legislation to provide transparency in medical training has now gained some steam. What's going on with that?
Yeah, Joe, this is legislation that actually passed all the way through the process last year and was sent to the governor's desk. And unfortunately, the governor vetoed the bill. It's legislation that organized medicine has supported over the last several years. It's really designed to provide transparency for patients. There's so many different medical practitioners that come in and see a patient, especially if they're in a facility in a hospital or something like that. And the theory behind the bill is just to make sure that that patient understands the training by which the practitioner or professional has that's rendering care to them while they're in one of those institutions. So it's a bill that we have supported. And Toni, what's the latest on this one this session?
We are seeing it move, both in but particularly in the House this week. It was up. There was some amendment language that was placed on the bill to address some of the issues of why the governor vetoed it in previous years. So we hope it's in a posture now that if it passes across the finish line, that the governor would sign it this year versus veto it.
Okay, that's something we've been tracking for a while now, and obviously still some progress needs to be made there, but we'll keep an eye on that as well going forward. Third topic here today is it's got some state level stuff and some federal level stuff. Is this a case of what Florida cannot do, the feds can do? CMS passes a rule to rein in prior authorization headaches. Fraser, take that one.
Yeah, who wrote that headline, Joe? That was creative for sure.
That was very creative. I think that might have been
I must have been
you.
feeling
I
it.
don't know.
Yeah, yeah. Yeah, a quick update on prior authorization. It's probably the number one issue that our doctors have concerns with. Currently, we hear their complaints all the time about the hassles they get from insurance companies around prior authorization. So I'm going to cover the federal update. Tony's going to give us an update of what's going on here in Florida. But federally, CMS did pass a rule that provides some of the key decisions or key reforms we've been seeking. It is limited, of course, because it's a federal rule to just government-related health plans. So your Medicare Advantage, Medicaid, and no sort of federal government programs, but it does provide transparency and timeliness. So if a physician sends in a treatment authorization request, if it's urgent, it has to be responded to within 72 hours. If it's standard care, it's 7 calendar days. They also have to be transparent with the physicians as well as their patients as far as the reason for denying any prior auth requests, and provide metrics, publicly reported metrics on the number of denials they make. So again, trying to drive some transparency and timeliness into the process. Overall, the reduction in hassles for physicians is estimated to save both physicians and hospitals between 10 and $15 billion. That's a billion with a B, Joe, over the next
Wow.
decade. So it's a big deal. It is limited to just your government programs, and it kind of mirrors what we've been trying to do at a state level as well, Tony. So that's where I'll kick it over to you to give us an update of what's going on in Tallahassee around prior auth and more transparency.
Yeah, and this is something that we've had a bill on for the last several years, and Representative Burfield has filed it this year, and she decided to step back since we have kind of felt some opposition to the bill over in the House. She said, let's get some data collection this year, and that would help us with data moving forward and supporting some legislation for next year. So her bill specifically looks at Medicaid managed care. And it would say that the agency would have to start collecting data on a couple of different things. It's not just prior authorization, but it's on provider credentialing, prior authorization, claims payment, and consumer complaints. And the idea is once we have this dashboard of data, that would support our claim that insurers are behaving badly, and legislation does need to be in place that puts, maybe strict timelines, for example, on how long an insurer can take while a patient and physician's waiting to get that prior authorization. And also, what's the main issue that providers are having with claims payment? Is it the issue of clean claims? Is it an issue of underpayment? So she's really hoping by putting this piece of legislation in place this year that next year we'll see the data we need to support a bigger reform package.
Yeah, and that's interesting too. Obviously, we're doing this week by week, but sometimes it's the long game, and you got to kind of look to well off into the future. It's not just a day by day; it's a year by year kind of a thing sometimes. Fraser, anything that we need to be talking about as far as the near future?
Yeah, there's a couple things, and since we have Toni, Toni's done an awesome job joining us today, and we're so happy to have her here. She's the best pinch hitter since Wade Boggs, I think, Joe. That's a baseball reference. Joe's a big
Yeah.
baseball guy, yeah, for sure. So we'll definitely have to have her back. But big picture, Toni, give us kind of a snapshot of where we are in session and kind of your feeling about how things have unraveled and what to expect as we're 4 weeks into process now.
Yeah, and we're 4 weeks, and so Monday we'll kind of be at that halfway mark. Most of the regular subcommittees in the House will start not meeting anymore. So that would mean if a bill hasn't been heard in that first subcommittee of reference, it probably isn't going to get heard unless there's something from above. Leadership, for example, has said it's an issue that they want to have move forward. So we also are going to be spending a lot of time the next week, a week and a half on the budget process. So a lot of the, air in the room is going to be sucked out by budget negotiations, because remember, the House has their budget, the Senate has theirs, and then they have to come to conference, what it's called conference, and agree on a final version of the budget for this year. We'll also see, though, the last couple of stops, say in the Senate, fiscal policy rules. Those committee agendas will be packed with bills that have made it through the first couple of committees, and they just need that last seal of approval. So some of the things that we hope to get over the finish line, this might just not be the year. And it's unique because they could be heard in one committee or two committees, and it's just that last committee that's left that might mean it's not going to make it over the finish line. But I will say, for all of our doctors who joined us in Tallahassee this session, your advocacy really did make a difference. There were some things that people never thought would move that, we have gotten heard, and we've got some really good testimony on the records. So Joe, like you were saying, some things we can do in a session, many things though, it takes several sessions, and really we have to lay the groundwork, which is educating legislators on the need for not only the doctor or the patient to have these protections, but also you're educating a House and a Senate, and many times the governor as well. We just heard about a bill that was vetoed last year. So we're laying that groundwork. So we've enjoyed seeing many of the doctors who have been to Tallahassee this session to help us in our advocacy. And if you didn't join us, we look forward to maybe seeing you before the end of session or next year.
A lot of work going on over there in Tallahassee, and boy, Fraser, well, Wade Boggs reference. Now I'm excited about spring training right around the corner. Pitchers and catchers reporting here before we know it. Well, this has been a lot of fun. Toni, thanks so much for joining us, and Fraser, as always, it's a blast kind of getting together with you each week and breaking down the headlines. Any last thoughts, Fraser?
No, not at all. Toni gave us a great segue because we're going to have another special guest next week. Who's going to break down the budget a little bit for us and what to expect in that process. There's a few things going on that organized medicine is pushing for in the budget as well. So next week will be a lot of fun as well. Not as much fun as this week because Toni was with us, but we look forward to doing this again next Friday.
All right. Well, thanks, Toni, for joining us, and we'll see everybody next week with another special guest.